Hi, it's Annie, and we're working today with getting more comfortable in your hips and your low back and your sacrum if you've had any kind of major injury. That should be really helpful as a healing rest position. So you're going to need a skinny blanket roll. You can see about the size here, or you could make it thicker if you are a little bigger chested, bigger stomach than me. You might want a thicker roll under your hips, and we're going to lie on the ground if that's comfortable. You can also do this on your bed, which works quite well if you're unable to get down to the floor or off the floor. So we're going to lie on your stomach, and this one I have under my ankles is helpful, as well as we're going to put this right at the crease of your hips. Use your forearms to lift yourself onto the roll. And then I have a small little towel, a squishy one that I could put between my breasts. This, for women, it'll be a lot more comfortable on the floor to use something like that. So you're going to lie like this and try your head to the side and see how that is with your head to the side. And you can adjust the height if you've got this towel between your breasts. And for men too, you might find if you've got neck difficulties in your neck, having this towel under your breastbone can be very helpful. All right, so you're going to lie like this, and if you need to have your head right in the center, that is just fine. And then make sure you adjust this hip roll so that it's really, there's a sense of an apex or the height of the back of your pelvis when you lie like this. And so adjust that as you need to. It's right sitting above your pubic bone, a little bit of pressure on the pubic bone. It shouldn't be too much. And then I like to put my hands near my head. Depending on how your neck feels, you can put one arm by your side and one arm by your face. And then you're going to just relax and let nature and gravity do the work here. Breathing and relaxing, and let the rolls support the bones. And see if you can let your body settle into the ground. Okay? And we're not going to stay here too long. You can experiment with the length of time, but if you've got a significant injury in your low back or sacrum, don't do long periods in the beginning to make sure you can get out of this position. That's important. And then carefully, you can bring your both hands by your head, lift your head, and turn your head the other direction. And there's going to be one direction typically for people that they can turn easier to. If it's really uncomfortable, turn your head to that other side. Just rest on your forehead in the middle. And then relax your shoulders, relax the pelvis. And sometimes you can kind of squeeze or push your pelvis into the floor and then relax. But if that causes pain, just relax. Just chill out here. See if you can let the gravity alone help align your bones. And then let's push with both hands by your shoulders. Gently push yourself back up to kneeling on all fours. And before you do anything much, especially if you've had a back injury, just hang out here. You can just move a little side to side on your knees, or make some small little crawling movements with one knee forward and putting some weight on that knee, okay? And if your knees can't tolerate this, then you'll skip to the next step. But this is so helpful for your back to stabilize, is to make some little crawling motions, bringing one knee back, one knee forward, one hand, and then just a little bit of crawling up and back. So I'm going to move these out of the way. So just gently crawling, and then if it's comfortable, you can come and lie down on your belly, or you can stay there and just feel the contact now of the pelvis, of your back, or roll onto your back and have your knees bent. And feel the weight and the contact with the ground here. Again, if your head is cocked back, you can put a little something under your head so that it's level. And just resting. Now I have these 2 other videos with a rest position with your legs resting on a couch or a chair or a bench. In this position, that's an awesome position to go back and forth between that position and this working with the roll. And then very gently roll to your side and use your arms to help you come up. And then you can come to sitting or standing. But this position of working with a roll and resting like that can be very helpful for all kinds of different injuries. If you've gone through childbirth, a lot of times the pelvis is out of alignment, and that can be very helpful after childbirth. It can be helpful after surgery, back surgeries, all kinds of different things, but very gentle. Stay short periods of time in the beginning with it so that you're safe to come out of that position. Okay? All right, I have more that will continue with this lesson, but I want to start really conservative with just the real basics right now, and then we'll go from there. So thanks for subscribing. Thank you for joining my Patreon site to support these videos, and I'll see you next time.